Hi, good morning and welcome to DentistChannel.Online. Hi, good morning and welcome to DentistChannel.Online. I'm Dr. Aparna Pandya, and today with us we have Dr. Sugan, and she's going to talk to us about digital technology and employment in healthcare sector. So, doctor is actually certified in several things, like she's certified in conscious sedation and updated in ABLS. She's certified in aesthetic dentistry, facial aesthetics, and orthodontics. And currently, she owns Dr. Mittal's Kids and Family Dental Care, which currently has two branches running in Bangalore. She's the director and founder of Kuchto Technologies uh, Private Limited, which is a medtech startup. And she's felicitated by Kodak Life for services provided during COVID outbreak. She's also awarded Women Achievers Award 2021 by Karnataka Women Power and Empowerment and awarded for the role of secretary in Rotary Bangalore, and she has been in youth development chair Rotary Bangalore. So it's actually a great pleasure and absolute honor to have you with us, Doctor. Over to you.
Thank you so much, Dr. Aparna. And I'm so excited to be here today. The lovely morning and the climate is amazing in Bangalore. I think you are attending it from Mumbai.
Yes, yes.
And thank you so much. And I'm really excited to be here today. So this topic has been of very much importance and touching to all of us, employment and the competition which is arriving in dentistry. And we feel that there are so many dentists, how to run your practice. And
Yes.
like we feel as if the saturation level is down. So today I would like to talk on that and have a little insights of what really is happening. So I would like to share my screen now. Is that good?
Yes, Doctor. Yes.
Is my screen visible?
Yes.
Okay. So basically we have a startup. Healthlancers.com is the brand name of it. It's Kusto Technologies Private Limited. And the platform is only for doctors and dentists. So what is the current main problem going on in the healthcare system is majorly two problems. There is deficient infrastructures and there is deficient manpower. So according to Global Health Index, India stands at 154 out of 190 countries. And if we see more deeper, we just have 9 beds and 7 physicians for 10,000 people population. Whereas Japan has 137 beds and 21 doctors. Now there is always, like, India is, we keep hearing India is facing shortage of doctors and nurses. Even during pandemic there was a big problem that there were no doctors. Suddenly where to get the doctors from? But the scenario from where as doctors we are seeing, we feel there is so much of unemployment. There are no though there are no doctors, there is no employment. So why is this problem exactly happening? So I just tried to find it out, and then we got to know that India is actually 70% of India's population stays in rural India. Only 30% of India's population is in the urban areas, whereas doctors' population is 30% in rural area and 70% in the urban area. Now this is there is a paradigm shift in the demographic distribution of healthcare human resources. So at one end, people feel there are no doctors, and on the other hand, doctors feel there is a lot of competition and not enough work. The same problem is there in the infrastructure also. When I say infrastructure, it means clinics and hospitals and the beds. So according to the statistics, there are only 6.8 beds per 10,000 population which are there, which is really, there is a shortage of it. And on the other hand, we see that there are so many hospitals and clinics shutting down every year because of high operating costs and lower enforcement. So can this problem be sorted? Is there a solution to it? Or is it just limited to this much? Is the problem more? So we found out further, and the employment rate when we saw in medical field, almost everywhere it is almost similar, that it runs in the self-employment state. And when we take dentistry, 91.7% of doctors are self-employed. Only 8.4% are employed in the government and the corporate sector. Now, these 91.57% doctors who are self-employed, they have to have their own infrastructures, which is again expensive. Apart from the long duration of studies and loans, education loans, there are no campus selections. And it is, again, the statistics have shown these, among these self-employed doctors, 72% of them do not own a clinic or a hospital of their own, which means they work as consultants. Then we started a survey that how do these consultants find work then? They don't have their clinic of their own, they don't have a job. How do they find consultations? So we asked this question, what are the modes via which you find consultation work? So 78% of dentists said that they find work via their friends. And 72% of them said that they directly approach the clinics and the hospitals. 44% said they also find work at social media platform. The same question was asked to the clinicians also, how do they find consultant for their practice? And 75% of them said that they put it on WhatsApp group and from there they get an answer. They find somebody. But the people who are searching, consultants never said that the WhatsApp is used by them. So it is on, because they're not there on those WhatsApp groups where the jobs are appearing. There are so many WhatsApp groups, there are so many social media pages, platforms, and the jobs and work is all segregated and everybody cannot be a part of every group. That's why a lot of jobs get lost. A lot of consultation works get lost. Again, some more statistics, we found that though the number of females who pass out or become dentists and doctors are more, almost around 5,000 doctors who are made till now are females, extra, more. But when the statistics are seen in the work field, they only form 37%. So where are these females lost? It's because of the work-life balance, which is very difficult for females to manage. They may not be able to work on all the times or full 9 to 5 job or not on all the days of the week. So there is a huge brain drain going on. There is also a huge brain drain going on where the doctors are leaving country because of the low pay scale. At healthlancing.com, our mission is to empower healthcare professionals by digitalization, to help them enhance their practice and to enhance their reach. Our vision is to make healthcare available to every citizen in every corner of the nation, as health is every human's right. So how do we do this? And why did we name it as healthlancing.com? We commonly use consultation and consultant words. Why not use the same words? Now, consultant is used for somebody who just give their consultation view, whereas as doctors, as dentists, we have to perform the procedure. We don't just have to give consultation. Hence, we need a new terminology. Now, it can be something similar to freelancer and freelancing, but again, these words are different. For a freelancer can also complete the task right from the comfort of their home, whereas a doctor has to go to a clinic or a hospital to complete the procedure. And just a consultation on screen sitting at their home can be a teleconsultation until and unless we start differentiating between these terminologies. These kind of works would be hard to pop up on the digital world. Hence, we need to give it a new name so that these kind of works can start coming up in the digital Google and other platforms. Now, this is how our website's mobile view appears. And these are the current services that we are providing. So I will go on discussing one by one. There is a book a health plan service. In this, the specialist can be booked by a clinic or a hospital. So you can select whichever clinic branch of your clinic it has a requirement. You can choose between Ayurvedic doctor, allopathy doctor, dentist, or a nurse. You can choose a specialization and then you can choose for what procedure you require a doctor, whether it is for consultation or whether it is for root canal or any particular procedure. So the doctors who are registered will open up like this in the search list. whereby you can compare with their experience, how much they are going to charge you, their gender, how many kilometers they are from your place. And you can even go for more details and know about them, their time availability and days availability, and book them. So it is as simple as that, and you can have a consultant for your clinic who best suits you. So that was one service. The second service, how we can digitalize this entire process is by booking clinic, sharing the infrastructure. Now, every doctor is trained in medical in their own fraternity, and they're not very good with running the entire business. And practice is actually a kind of business which requires a lot of other skills: financial management, staff management, taking care of the bills and repairs and products, services, labs. There are a lot of other things, marketing and sales as well included, which doctors usually don't like. Plus, the infrastructure setup itself is very expensive, and everyone cannot afford it. So now, if a consultant, any doctor in any location has a patient, can book a clinic nearby. It comes similarly in the search result. These clinics are ready to share their spaces, and you can see their time, working times, and working days which are available, and book the slot. Take your patient there, and you can complete the procedure. So thereby, you don't have to take care of the entire running of the practice. You can just focus on the treatment aspect. General hiring can also be done for clinics and hospitals who are looking for full-time vacancy, which is a very conventional way, and this is the only way which appears online today. These kind of jobs, we have various platforms like Naukri or Indeed, and so many platforms are there for general hiring. You can again choose what area you are looking for, which clinic, what particular field you are looking for, and which specialization. Thereby, the list of the doctors who are ready, who are looking forward to join some clinic full time, will appear, and whoever suits you the best, number of years of experience, their degree, their qualification, distance from your location, you can book them. As I said, for the next service, job board, healthcare sector is very much unorganized, private sector especially in India, and there is no particular platform where everyone can have a look at. So there are thousands and thousands of Facebook groups, like periodontist group, endodontist group, state-wise, college-wise, country-wise, language-wise, male groups, female groups. So there are too many for anyone to be a part of all the groups. We kind of target and accumulate the jobs from all social media platforms, how much ever we can, and we put it on the job board so that most of the jobs can be viewed by most of the people and can be benefited. Recently, the next service which we have launched is the intern booking. Now, internship, which is provided today by the college, is theoretical, diagnosis, and treatment. But to run a practice, when you step out in the world, real world, it is much more than that you require to run a practice. How to communicate, how to manage, uh, what are the charges, how to do the registrations, and there is a lot more to run a practice. So internship in the private clinics and hospitals will give the interns a lot of wider experience and exposure, and to the clinics and hospitals it will provide a lot of new fresh ideas, creative minds, people eager to learn. It will also make you a leader in the community. It is a mutual benefit to both the clinics and to the interns. And now the interns can also be booked via this platform. And internship is not only just for for the freshers. Internship is also can be opted like by the specialists to work under some really high profile specialist and learn particular procedure, have experience in a particular subdomain. Also, a lot of females take a lot of breaks in their professional careers, which may be due to marriage or due to child or due to any other uh, personal works, and then they lose their confidence. After a few years, when they want to join back the practice, they lose confidence. To gain back that confidence, they can opt or choose this internship for a few months and get back to their practice. Recently, we have also added one more system to our software, which is to manage appointments. Now, for clinics, there are a lot of softwares which can keep a track of your appointments. But for clinics, consultants, different clinics, different patients, there is no system where you can have the appointments system managed for the consultants. So here we have a system where appointments can be easily managed. Our next service is highlights, which is quite going very well and people are benefiting from it. It is something like this. Consultants who are actively looking for jobs can have this poster on our website top. Thereby, a lot of other doctors will have the visibility and they can be approached by the clinics and hospitals directly. Visibility is very much important, and we as medical doctors, we are hesitant about visibility. We don't mind going individually and approaching clinics and hospitals. But I think it's required, it's high time that we go digital. Going in person is highly time consuming and it's very restricted circle. Digital, the platform makes it very fast, very quick, and the boundaries of location goes wider. So how are we different from any other platform? As I said, there are multiple platforms like Naukri, Indeed, but they are only for the full-time jobs. And in medical sector, there are only the bulk jobs are not there like corporates. So the number of jobs which are popping up are very, very few. People are hesitant to just put one job, one requirement. Also, the word of mouth takes really long time to spread. If somebody has a good practice, some doctor is good or not good. So via digital footprints, it's very easier to go faster. Digital stamping will help to cross the location boundaries, which means if you are practicing today in Mumbai and tomorrow due to some reasons you have to shift to Bangalore or Chennai or any other location, just changing the location online, you can immediately start getting work in whichever location you are there. So you don't have to become an entrepreneur now. You don't have to take care of everything. Just do what you like to do. Now, most of the time, when you apply on any of the digital platform, though you have registered with them, for every job you have to keep an eye daily and you have to keep applying for every job which comes individually. Whereas on this platform, once you are registered, you don't have to apply and reapply. Whenever there is a new job, whenever there is a new opportunity, you directly get a mail into your mailbox. You get a message on your phone. And we most of the job portals are location based, but we are area specific. So it is not Bangalore and Mumbai. It is in Bangalore, which area you get work and consultations in and around your area. You don't have to undergo lengthy procedures of hiring and interview every time, because the system has the rating and review system. Every time you work, your cases are recorded, and the doctor or clinic can have a look at it, that how many cases have you done so far, how good you had done those procedures. So your digital reputation is maintained and it can be carried over. With single registration, all the services can be benefited. You don't have to register separately for the clinic sharing. You don't have to separately register for the intern booking or any other thing. One registration and all the services can be utilized. There is zero decay rate. Now, what does this mean? For example, if there is, for let's take an example, if a college or a corporate BBMP or something has two job openings and 20 applicants have applied, although there are always more than that applicants who apply. So they choose only two candidates. The 18 applications go waste. Whereas here, the two who are selected, they've got the job. The rest are not decayed. You don't have to apply again and your applications are not lost. You get the next jobs. The active job seekers, the active uh, employers, full-time employers or the consultants can now get featured in the highlights. And this highlight goes only in the doctor fraternity, medical fraternity. It does not go into the patients or the layman's. So this is a way to reach out faster to your community and say, hey, I'm here and I'm available for the work. What else is coming? So the payment part can also be tracked now on. And the problem of you keeping a track of it, managing it, asking your clinic or hospital to pay would not no longer be required. Another very good feature which we are focusing on is rural India. Uh, as we had talked upon initially at the start of this talk, the main reason why we have started this is we want every individual of the country, every person to get a healthcare service for him. But there are no doctors in rural India. But what if by AI, if we can connect and show you in the morning that there are 4 cases of impaction here, a doctor may choose to travel to that location in the morning, complete those cases, and come back. And the AI will also help detecting the patterns to who the most probable candidates can be, the most suitable places for the most suitable candidate, thereby making the whole process more practical. Thereby, people in rural India will get the treatment and doctors, dentists will get a lot of work. So this is a very new thing, and our innovation has the potential to impact the life of 1.3 billion population of India. We welcome you to join and be part of this change.
Thank you, Doctor. That was a very, very lovely presentation, very innovative, and I would say it's the need of the hour. So,
Thank you.
yeah, it was really amazing. So before we take up the questions, I would like to uh, share our company presentation. So, DentistChannel.Online is the first digital dental media, and we provide services for both dental professionals as well as dental organizations. Several services are provided like dental news, webinars, courses, events, videos, IT services, Prime membership. You can submit scientific articles, dental business, contribute by providing videos, or buy and sell. For organizations also, we provide several services like you can host events, graphic design, social media, website development. We also provide participation certificates, event registration, consultation, content writing. You can list your business or advertise with us. So we have done more than 700 live dental webinars and 25 plus dental workshops. There are more than 40K participation certificates which have been issued and 400 plus national and international speakers. There are more than 300 plus oral care videos under Save the Truth hashtag. So we have also been certified in India Book of Records for maximum speakers participating in virtual dental program on oral implantology. You can avail Prime membership now, and there are several benefits like you can have a personalized account. You can access all the webinars organized by Dentist Channel, and you can get special discount on dental courses. You can also have CPD CD points, which you can directly download from your profile anytime. You can get regular updates and news about dentistry. You can access several articles and participate as a speaker or publish public awareness videos. So this is the participation certificate with which everyone will be getting at the end of the webinar. And you can avail Prime membership at $7.99 per year, which is equivalent to $10 USD. And if you use the promo code AP100, you can get assured discount. So these are our upcoming webinars. And yes, thank you so much. So Doctor, now we can take up some questions. First of all, I would like to know, is this app that you were talking about, this wonderful app, is it available in Play Store? Doctor, you're muted.
Yes, thank you. Yeah, this is not an app, it's a progressive web app. That is, you don't have to download anything. It's there on the
Okay.
website itself, and the
Okay.
website itself will act as an individual's app. Now,
Oh,
why we have done this is uh, when you download an app, you have to give access and you have to give permission for everything except your data is very secure. You don't have to accept anything, and still the website will function like your app. You can open it at any time, and it is your individual app.
yeah, that's interesting. And is it free or is there any charge?
It will be charged. Currently, it is free to use. Out of our 7 services, only one of the services charged, which is highlights. So the registration and the entire thing is completely free for now.
So is it available only in Bangalore or everywhere?
We had started with Bangalore, and though we had started with Bangalore, we started getting registration from all over India. So currently we have 1,000+ users, registered doctors and hospitals, clinics from all over India. So the software works all over India. Our special efforts are being made in Mumbai and Bangalore.
This is really great, Doctor. It's a wonderful initiative. Really
Thank you so much.
excited about it, and all the best. And
Thank you so much.
it was a great session, Doctor. Very eye-opening. Lovely to have you with us. And
Thank you so much.
and
It,
yeah, all the
it
best for
was
your
great to
future.
be here.
Yes.
Thank you.